Hi, I'm Laura Murphy and I'm a district nurse team manager. I manage a district nurse team in the south of Birmingham.
Nice to meet you. My name is Azim Suleiman. I'm the founder of CSMA Birmingham, which is Kutchi Sunni Muslim Association. We provide free bereavement support and free funeral services for the needy and free funeral advice for everyone. Every community, of course. It's a pleasure to meet you today. Got a couple of questions for you.
Okay.
One of the first question is what is the actual role of a district nurse? Can you explain?
Yeah, we see patients at home for a range of care, which can start from simple wound care, post-operative care, catheter management, all the way down to palliative care and palliative support for the end-of-life patient. We provide a range of services in the community, and our main clientele is the housebound patient.
How do the district nurse support the families and the patients at the end of life?
So normally we would have a referral into the district nursing service from the GP, the hospital or the hospice via our single point of access phone line. We then would arrange a telephone call to the patient or family to arrange a visit from the district nurse, just to offer our services and what we do support-wise. Once that's been established, then we normally communicate with the main caregiver and the patient with them at the visit and discuss what their future plans are, their preferred place of care, where they want to die. We ensure that they've had a discussion around respect forms, which does have a do not attempt resuscitation decision that's normally discussed with the patient's GP or medical consultant at the hospital. Once that's established, then we will provide equipment to the patient, which consists of profiling beds, mattresses, cushions, just to ensure their environment is equipped. We have a dedicated phone line which patients can contact or family members can call through should they need a district nurse to come out and administer any medications. If the patient does require that level of service, then we may consider putting them on an infusion, which then gives them 24-hour administration of medication, and then that's replenished every 24 hours. We offer support for families because they need rest at this time. It is a huge responsibility, and it impacts on families. So we can signpost them then to services that will provide day and night sits, which just gives them that little bit of respite.
Okay, and how do you actually work with the GPs? Because I know you're a district nurse, you probably cover a wide area.
In my team specifically, we cover 6 GP practices, and what we would intend to do is have meetings. They used to run once a month or so, and it would be discussion of patients who are on the gold standard framework, their diagnosis, how they're managing at the moment, whether they're stable or changing. And it's a good way for us to know who's coming onto our caseload. If we're working with or caring for a patient who's currently palliative and at the end stages of life, we liaise with the GPs to have medication readily available should they need stat doses. During the pandemic, there has been less face-to-face contact with the GP, so we just discuss things remotely with them. But if there is a need and we need them to come out and visit and do a joint visit with us, then they're happy to do so.
When a person is dying, how will your team support the families?
It all starts with a conversation about the natural changes that the patient will experience through the dying phase. This can be reduction in diet and fluids, and reduction in communication, and also the patient sleeping more. And having those conversations, it allows the families to expect these changes to occur and not be afraid. We have leaflets which put it in very simple terms that we can leave with families to read at their own leisure. What's important is that these discussions have been had with families by their caregiver, by their professional person that's involved with their care, with a discussion about what their wishes are towards the end of their life, what their preferences are, and that's all recorded, so any other health professional that sees the patients, it's documented and the questions don't have to be asked again and again. It's written there. When there is changes that are happening, the families can contact us and we can arrange to come out and assess the patient.
What happens when a person dies at home? Who do the family contact and what is the process?
So when a patient dies at home, a phone call will be made into the service. At that point, a nurse who has been trained in verification of death will attend the patient's home and verify that the patient has actually died. Following that then, the GP is informed of the patient's death and the GP will complete a certificate of cause of death, which then gets sent over to the registry office, and at that point the registry office will provide a death certificate for the families. We offer to wash and dress the patient if they want us to, set out clothes which they want us the patient to wear, and then the funeral home is contacted by the families. We offer bereavement packs to the families which has a step-by-step guide of what to do next, because sometimes you don't think about these things and it's just there as a little aid for them. And at any time then we can contact for a bereavement visit and go and have a chat and feedback about their experience. I mean, sometimes at the time of death, families don't want to talk about it, and as long as the option's there that they can come back and if they want to talk at a later date, and there's other services out there as well that will support with bereavement, so we can always signpost if that's the case, because the aftercare is important as well. As a district nurse, it's important to us to understand what matters to patients and their families. Would you be able to explain some of the Muslim beliefs so we are then equipped and able to support families at home?
As a Muslim, what we believe is when a person dies, they need to be buried quickly as possible. And of course, but that all depends on, of course, the situations and the condition of the case as well, and of course where you live. In, of course, abroad countries, there's different rules and regulations. In England, we've got different rules and regulations. As a district nurse, I guess you can verify the death, you can't certify the death. Am I right? The GP still has to write the cause of death.
That's correct, yes. So as a health professional who's undertaken the training, we can verify that a person has died, but the actual medical certification needs to come from the GP or another medical professional.
What happens if the GP hasn't seen the patient for a while, even though you have, but the GP hasn't for, let's say, 28 days or more?
So we hope that that doesn't occur.
So I guess a good case scenario is most patients, because they're end of life, they already had contact with the GP. But I guess because of COVID, everything is on video cam, so as long as the GP can see the patient within 28 days, I believe,
correct, yes.
The GP should be able to write the cause of death supported by yourselves.
Yes.
And if it's more than 28 days, it can go to a coroner or the GP, depends on the records, I guess, isn't it? So am I right, the advice you should give to the families is, if it's more than 28 days, you should contact your GP if it's end of life? We
would do that. So
okay.
If we've met a patient and we can see a change in their condition and we feel they're slowly or even rapidly coming to the end of their life, then we need to make that call to inform the GPs that they need to see the patient.
I think the service you provide is brilliant.
It's a pleasure to be there for patients and families at the end of their lives. We have one chance to get it right, so you know, it's our passion to be able to be there for each and every person that needs us.